Okay, good afternoon, everyone. My name is Alberto Porciani. I'm the CEO of a company called Top Doctors. And I have to say thank you very much for inviting me, because it's a huge opportunity for me just to move from Europe to New York in order to understand how this market, and especially the healthcare ecosystem, is changing thanks to the adoption of the technology that we see here during these days. It's fantastic. Now, the reason why I moved is because basically, we recently achieved an agreement with Connolly Top Doctors, and basically we have probably some of you knows very well this company is the leading, I would say the US leading company in Top Doctors and Center of Excellence in Identifications, and with this partnership we are aiming to really capitalize and to really create the biggest and the best virtual hospital in the world. Today, we are counting on more than 70,000 specialists in 3 different continents, 8 countries, and we are helping more than millions of patients each year in finding the right specialist for their specific pathology and case. Now, before talking about Top Doctors, I would like to oh, sorry. I think it's wrong presentation. Okay. Anyway, I would like to talk about the reason why we are basically approaching this. The reason why we are trying to solve a kind of issues. Okay. So the first issue that we have is that we realize that basically we in Europe, in the US, we are seeing how the costs of the healthcare system is growing in many countries and many economies. Okay, we are the projection of the US is basically reaching an incredible number of 26% of GDP of expenses. So basically, we are really out of control of the cost. Also, we see some kind of let's say inefficiency in quality. Okay, so the third we see that is recorded, medical errors are recorded in the US as the third main problem and cause of death, just behind the heart disease or the cancer. Now, this is also we see how the chronic patients are growing dramatically, and also we know everybody is talking about the clear shortage that we have of clinicians and nurseries, and also the population of patients with more than 65 years are really growing fast. So this is a clear examples of problems that we have. Now, let me explain some of the specific issues and efficiencies of the healthcare system that we are trying to cover with the Top Doctors proposition. Basically, one is, the most important, is the unqualified patients. Unqualified patients means a patient that is not really reaching the right doctor, the right specialist, because is not the correct in terms of expertise of the pathology. So that's this year represents a huge cost. For example, in the US, we are talking about 4.5 billion per year. In fact, one of the recent studies that we have done is that one patient needs 2 weeks to identify the right specialist, and then they are used to visit 2 or more specialists before reaching the right one. That is a huge cost, and of course is one of the elements that we're trying to solve. Then we're talking about the chronic patients. I mean, we know that especially elderly people are visiting 7 different specialists and 4 different facilities. That is also creating a lot of difficulties for the case of the transportation. And then we are talking about no-shows. There is a huge, on average, 16% of the patients are not shown, and this is a huge issue for the waiting list and of course for the management of the scheduling. Now, one of the opportunities that we have is moving from a system that is hospital care progressively to a system that is more home care. And this is, of course, the opportunity is combining the hospital care and the home care together in order to create the value and adding more quality. So Top Doctors is really focused on helping the healthcare system to evolve in this direction. And our solution is based on basically the combination of two elements. The first one is quality, because we believe that quality is extremely important to provide a high quality of care, and then the access of the best to the best specialty via technology. So from one side, we have a specific selection process that is helping us to identify the best specialists in each specialty and subspecialty, and we will see how we are going to do it. On the other side, we are creating the base of top specialists based on quality, and we are building up on this network, on this platform, we are building up different technological verticals that are going to help the relationship between patients and doctor. So in terms of selection process, that is a process that has 25 years of experience in the US and is based on the peer-to-peer recommendation. Basically, we receive thousands of nominations by doctors because they are recognized among the best in their field. And then we have an internal and external auditing of all the doctors nominated by other doctors. And of course, we have a face-to-face visits by our consultant. This process that is extremely is a multi-step and rigorous process, is allowing us to really identify the best specialty in each specialty and subspecialty. But the most important thing is not really this point, is the fact that it is allowing us to really identify which is the expertise of each doctor. And then on this platform, we are creating the technological verticals. The first one is Symptom Checker. Basically, we are helping the patients in the process of the triage. Basically, it's more an orientation for the patients. So we are helping the patients to really understand which kind of specialty need to visit in order to solve their problem. So they're receiving from this artificial intelligence a kind of pre-diagnosis, and then they have an opportunity to match this potential pathology with a group of doctors that are expert in this pathology. This is clear because it's basically creating qualified patients. If you remember, this is one of the main issues that we have with a huge cost, and is helping the matching between the right patients and the right doctors. Also, our online booking system is helping the patients, is helping the doctors to manage in the proper way the scheduling, and also is providing a huge benefit in terms of reducing of no-show, thanks to some of the mechanism of reminder and easy change of the date of the appointment for the doctors. So this is again fighting against the concept of no-show and helping patients and doctors to have a better scheduling and also a better management of their agenda. And finally, last but not least, it's extremely important, the telehealth. We just introduced recently a telehealth platform. Today is just focused on video conference and private messaging, but it's basically opening a new channel of communication for the doctors and the patients, and basically is moving into what we are looking for, that is the home care. So our virtual hospital will be able to really provide in the future a home care to all the patients that are approaching our top doctors. And basically today we are most focused on the second opinion staff, and also the follow-up consultation or the pre-surgery consultation that can be easily, let's say, managed remotely. It's key, of course, for this, for the success of this transformation is the adoption of physician and of course, of patients, of the technology. That's the reason why we're working really hard in order to provide the platforms that are really easy to use, as well as training doctors in order to see the advantage of this technology and also promote the technology between all the doctors. And now, just for finishing, it's just to finalize, all the combination of these elements are really helping to bring some clear data of how we are able, thanks to the quality and the combination of technology, to reduce cost and to increase the quality of the care. Basically, one of the initial data that we have is 97% of the patients that are booking through our platform, they believe that they have the right expert that in their pathology. Basically, we are working on, improving the qualified patients, the right patient for the right doctors. 84% of the cases, a doctor member gives the correct diagnosis in the first visit. So it's reducing the number of visits per doctor. And also in 98% of patients who have undergone surgery with a top doctor's member have been operated using the latest technology. That is, of course, a better and faster post-surgery recovery. And finally, this is the first clinical evidence that we are producing, patients treated by a top doctor's member have a 20% higher rate of successful pregnancy with assisted reproduction treatment. So this is the first element of a clinical evidence that the entire process is really helping, and the combination of top doctors and patients, of combination of technology and quality is provided to the system. Questions?
Thank you so much.
Thank you.
Quick question. Maybe I missed it. Did you say where you get your revenue for this business? I mean, how does this...
How is the business model, you mean? The business model is a combination between, basically, it's a SaaS model. We sell technology. And in some countries, it's also a pay-per-lead model. So basically, we are generating, or where the regulation is possible, we are keeping a percentage of the transaction in the telehealth section.
Okay, it's a very good presentation. Actually, I have a very naive question about how you're going to define the top doctor or the best doctor. Just like in the battlefield, what do you think is a good soldier and a bad soldier? Because related to your percentage, the 84% of the case in the top doctor members can give a correct diagnosis. I'm doctor, I'm working for the global MD, global medical doctors. We are not going to ranking the doctor at the top or best. If the 84% of the accuracy and the 16% is inaccuracy, I will say all of them are not good doctor or not good. So give me the comments.
Okay, basically the most important point for us is not, we are not defining who is a top doctors, is the entire population of doctors that is doing. We are just the director of the music. So basically, the process is based on nomination process, right? So it's a peer-to-peer recommendation. It's other doctors that are nominating doctors that they believe are among the best in a specific field.
But when you register the doctors, is it become a top doctor or become just a doctor? Otherwise, the name is most likely they like misleading the patient to say, okay, there's a top doctor, others is not in the list, is not top doctor.
No,
is that correct?
No, the point is that basically the most important thing for us is finding the specialist, the expertise in each pathology. That's the most important thing, is all the process that we do in terms of nomination by peer-to-peer recommendation, so nomination by doctors, and also the ratings of the patients is giving an information to the patients that is extremely valuable to identify the right specialist for them. Now, the value for the ecosystem, I mean, for the value for the healthcare system is exactly matching the right patient with the right doctors. That's the value that is inside this process. That's the reason why we are doing and we're investing a lot of money behind the research of the doctors, because we want the qualified doctors, and we want to know exactly what they're doing, and we want to know why they are expert in a specific pathology, and then we wanted to match the specific pathology with the expertise of the doctor.
How do you distinguish yourself from ground rounds?
I mean, the point for us is really based on the quality. So the most important thing is that we wanted to create the group of specialists that are among the best, and on this quality we give the opportunity of the patients to approach the doctor in the way they want. So basically, if they want to have a face-to-face visit, we facilitate the online booking system. If they want to have a telehealth session, they can do it. So that's the basic element for us that is differentiated to any other player.
Well, the one point is I'm the orthopedic surgeon and in practice in Los Angeles. And about 5 months ago, I got a call from your office that consider me as a top doctor. I really don't know how they come out, but they really, when I talk to the office girls, they find out of me is I have to pay additional money in order to put my name on the list. So in other words, this is the top doctor is a buyout from some level how to pay. So anyway, I think that's probably your business to the model is doing. But again, so this will make the quality of a doctor on the list is really questionable as well.
I mean, I'm happy to know that you have been nominated by peers, and that's the reason. The point is, as I said at the beginning, we provide technology to doctors. So they are not paying to be a member of Top Doctors. That is the least that we have, and this is the reason why you are there is because other doctors nominating you and they consider you as probably one of the expert in your field, among others, and that's the point, because you are recognized as Top Doctors. Now is the choice of the doctors to acquire and to use the technology that we provide them, and for such reason they will pay. Otherwise, they will just, of course, nominate it as a Top Doctors. That's a huge difference.
Yeah, thank you so much.